Hello and welcome to Pace Hospital's podcast. Today, we are diving into a common yet often misunderstood health condition that is gallstones, also called gallbladder stones. These small hardened deposits in the gallbladder can cause discomfort, pain, and complications if left untreated. Joining us today, Dr. Suresh Kumar, surgical gastroenterologist and laparoscopic surgeon, having wide expertise in treating and managing gallstones. In today's episode, he will demystify this condition, explaining what it is, its causes, how gallstones form, their symptoms, and the available treatment options. Dr. Suresh Kumar, thank you for joining us at Pace Hospital's Hitech City. Let's start by understanding what are gallbladder stones and are they related to kidney stones?
So gallbladder is an organ, pear-shaped organ that is right beneath the liver. So most of the times people confuse these gallbladder stones with the kidney stones. Any stones that occur within the gallbladder are gallbladder stones, and when it comes to kidney stones, it is the stones which is occurring in the kidneys. So right from the diagnosis, presentation and management are entirely different when it comes to kidney stones compared to gallbladder stones.
Dr. Suresh Kumar, why do gallbladder stones occur?
As we discussed earlier, gallbladder is a pear-shaped organ that is placed right beneath the liver. So any stones that are within the gallbladder are called as gallstones. So what causes these gallstones? So as we discuss further, the main function of the gallbladder is storing the bile. Bile is actually produced in the liver, and this gallbladder stores that bile and concentrates over time. So when there is increased concentration of bile or cholesterol within this gallbladder, it leads to gallstones. As far as gallbladder stones are concerned, it is very important to know the risk factors rather than the causes of gallstones. So there are certain categories of people in which the gallstones are seen more commonly when compared to other group of people. These includes traditionally any female in reproductive age group, that is 20 to 40, and who is obese, are more risk of developing these gallbladder stones. It doesn't mean that gallbladder stones doesn't occur in men, otherwise in men. They do occur in men also, but they are commonly seen in female in 40s. Traditionally, we are taught that fat, fertile females in 40 usually come up with gallstones. Apart from these obese patients, and these gallstones run in families also, because there is certain genetic predisposition which are seen in gallbladder stones. And in certain areas, people residing in certain areas, these gallbladder stones are also commonly seen when compared to other group of people. And also in patients who present with drastic change in the weight, it also is a risk factor for gallbladder stones. This can occur due to diet modifications or due to after any surgery, and after any surgery, whatever the cause or risk factor for the gallstones, the diagnosis, management all remains the same.
Could you explain what are the symptoms of gallbladder stones?
So most of the times gallbladder doesn't show up any symptoms, but when they show any symptoms, most of the times it is pain, especially in the right hypochondria. We call it right hypochondria or right upper quadrant, this region pain beneath the area of liver. The pain usually seen after a heavy meal, during lunch or dinner. They cause severe pain that can radiate to back or shoulder, and these pain can last for half an hour to sometimes few hours. Apart from this biliary colic, which is a common symptom of gallbladder stone, it can also present with complication arising from the gallbladder stones. It includes jaundice that can present with cholangitis. Cholangitis is a clinical constellation of symptoms which include fever, jaundice, loss of appetite, and general illness. And sometimes it can even present with pancreatitis. Pancreatitis is inflammation related to the pancreas. When it is due to this gallbladder stone, it is called as biliary pancreatitis. In rare instances, certain malignancies related to gallbladder are also shown to be related to gallstones.
So doctor, what are the complications of gallstones?
So apart from biliary colic, which is a common presentation, these patients usually present with certain complications which include jaundice related to gallstones, pancreatitis, that is inflammation of the pancreas, or certain malignancies, that is cancers that are related to gallbladder. So Most of the times it is not just the biliary colic. These can also present with certain dreadful complications.
Are gallstones a serious problem?
So whenever these patients are diagnosed in time and managed accurately, these patients can be treated easily. But whenever they are neglected, these patients can pose certain dreadful complications.
Dr. Suresh Kumar, which gallbladder stones need surgery?
Does all the patients with gallstone need surgery? So whenever the patient presents to a doctor with symptoms related to gallbladder stones, that is symptomatic gallstones, these patients should mandatorily be treated. And whenever the patients be detected with gallstones on regular follow-ups, these patients can safely be kept under watchful waiting.
Does every patient require treatment for gallstones?
In certain patients who are sensible and who understand the problems associated with gallbladder stones and who can pick up these symptoms related to gallbladder stones by themselves and can approach any surgeon or a doctor in time, can safely be put under watchful waiting as far as they are asymptomatic, that is, that they doesn't show any symptoms related to gallbladder stones.
So, doctor, can drug or water dissolve gallstones?
So there are certain modalities of treatment which are actually reserved to patients who are unfit for surgery, for any form of surgery. In those patients, we can try these non-surgical methods, but these methods carry very high degree of recurrence. So usually we do not encourage patients to opt for this kind of treatment.
Is there a non-surgical treatment for gallstones?
So there are certain non-surgical options for gallbladder stones also, but these methods are reserved for certain category of patients who are deemed to be unfit for any surgical method. Hence, these methods are reserved for only that category of people. Whenever we feel the patient is fit for surgery, we usually recommend them to undergo surgery, because surgery is a one-time treatment for gallbladder stones.
Can you explain how to diagnose gallstones?
Whenever we suspect gallbladder stone in any patient who present with classical symptoms, the first investigation we advise is a simple ultrasound scan, because most of the times, more than 90% of the times, these gallbladder stones can be picked up on a bedside ultrasound scan.
Does the size or number of gallstones matter in treatment?
Usually it is the symptoms that are associated with gallbladder dictate the management, and not the stones or the number of stones that are actually present in the patient.
Dr. Suresh Kumar, at what age do gallstones occur?
So most of the times these patients, as I said, these gallbladder stones are seen in middle-aged and especially reproductive age group women. But these gallbladder stones can be seen in both the extremities of life, that is less than 10 years, and in elderly patients also. But when they are seen in these extreme age groups, certain other investigations are mandated.
So, doctor, can gallstones cause gas?
Yes, excessive gas formation can also be a symptom related to gallbladder stones, because in certain group of patients, these symptoms associated with the gallbladder will be so atypical, and most of the times it could be something termed by the patient himself as gas. So whenever we see patients who complain of excessive gas, we do suspect gallbladder stones.
Let's talk about treatment. What is the main treatment for gallstones?
The gold standard for gallbladder stone treatment is gallbladder stone removal along with a gallbladder. It is most of the times done laparoscopically. So laparoscopic gallbladder removal is the gold standard treatment for gallbladder stones, which we call at laparoscopic cholecystectomy.
Can you explain us what foods can cause gallstones?
Traditionally, foods that are rich in fats, oils, and are made of excessively processed wheat, or any flour or any sugars are risk factor for gallbladder stone formation. So this food can also lead to obesity, which is indirectly a risk factor for gallbladder stones.
Dr. Suresh Kumar, how fast do gallstones grow?
So it is very difficult to predict at what rate the gallbladder stones grow, and it is also not an important issue to deal with. So whenever we see a patient with gallbladder stone with classical symptoms, we do not think about the rate at which they grow, because as I said, neither the number nor the size of the stones that dictate the management.
So doctor, what are the complications of gallstones in diabetic people?
So as I said previously, all the complications that are associated with gallstones can be seen even in the diabetics. But in diabetics, these patients are at higher risk of developing infective complications related to gallbladder stones, which include pus formation within the gallbladder.
Dr. Suresh Kumar, one final question. Will removing gallbladder affect the digestion?
So usually any symptoms that is seen after gallbladder surgery, that is removal of gallbladder, are short-lived. They are seen for a couple of months. For all practical purposes, it should be kept in mind that gallbladder stone surgery is a safe surgery and is not associated with any long-term problems. And whatever the problems we see in the immediate post-operative period, that is increased frequency of motions, flatulent abdomen, all will be short-lived. That is, they are seen for a couple of months at the most. This is our attempt to answer the frequently asked questions related to gallbladder stones. If you have any further queries, you can contact Pace Hospitals, Hitech City.
Thank you for sharing crucial information regarding the gallstones to our listeners. I hope this information can be valuable for the listeners. And remember, your health is a priority, and addressing issues like gallstones early can lead to better outcomes and improved quality of life. If you have any further questions regarding gallstones, please don't hesitate to consult a gastroenterologist. Remember, gallstones can be painful and uncomfortable, but with the right knowledge and treatment, they are manageable. We will see you soon on Base Hospitals podcast with another episode. Until next time, take care of your digestive health with a balanced diet, regular exercise, and proper hydration. Stay healthy, and thank you for tuning in.